Okay, so today we're going to assess a newborn. First, I'm going to perform hand hygiene and don some gloves. Next, I'm going to identify the baby with two patient identifiers. And we want to ensure a warm environment so the baby doesn't get cold because they can't regulate their own temperature very well. I'm going to warm my hands and warm my stethoscope prior to use so I don't make the baby lose any more body heat than necessary. First, I will take a blood pressure if indicated. We want to do that on the upper thigh, and the cuff should cover 2/3 of the thigh. A normal finding in a newborn's blood pressure is 50 to 70 over 30 to 45. Next, we're going to assess the temperature. So I'm going to get an axillary temperature right in the armpit. Normal finding here is 36.5 to 37.2 degrees Celsius. If it's a heavier baby, they may measure slightly higher than that. Now I'm going to get the baby's pulse. I want to find the point of maximum impulse here on the chest. It's usually between 4th and 5th intercostal, just outside of the mid-clavicular line. Once I found that, I'm going to warm my stethoscope up and count the heart rate for a full minute. And normal finding here is going to be 110 to 160 beats per minute. I'm also going to assess the heart sounds. And I want to note rhythm, strength, and rate. Some murmur is a normal finding in a newborn. The heartbeat should be strong though. Okay. Now I'm going to assess the newborn's respirations. Normal findings here is 30 to 60 breaths per minute. First, I'll observe the respiratory rate for an entire minute. I want to observe for synchronization of the chest and abdominal cavities. Observing for retractions and cyanosis as well. Those would be abnormal findings. Now I'm going to compare breath sounds bilaterally. They should be clear and strong. Going to turn the baby. Make sure I get this lobe too. Always going to compare it to the other side. And carefully turn the baby over and compare the breath sounds on the back as well. Listening for crackles or rhonchi, which would be abnormal findings. All right. Turn the baby to its back. Now I'm going to auscultate the abdomen for bowel sounds at all 4 quadrants. Normal finding would be soft bowel sounds. All right. Now, if the baby's crying, you want to observe for a moderate tone and pitch. That would be the normal finding. A high-pitched cry is abnormal and could indicate something else being wrong with the newborn. We're also going to weigh the baby, so a normal weight would be 2,500 to 4,000 grams. Next, I'm going to do some measurements. So first we'll measure length, which is going to be from the top of the head to the heel. Normal finding there would be 48 to 52 centimeters in length. The baby's going to grow about 10 centimeters within the first 3 months. All right, now I'm going to measure the head circumference. It should be just above the eyebrow where you measure and right around the occipital protuberance, so you get the biggest circumference possible here. A normal head circumference is 32 to 37 centimeters. And I'm going to compare that number to the chest circumference now. We're going to go just below the armpits, right about nipple level. And a normal chest circumference is 30 to 35 centimeters. You want to compare the head and chest circumferences, and the head circumference should be right around 2 centimeters larger than the chest. Now I'm going to just observe and note the baby's posture. It is normal finding for the body to be flexed, the legs may be flexed, the hands may be slightly clenched. The neck looks short due to the chin kind of resting on the chest. And in breech births, feet may be dorsiflexed a little bit. Now I'm going to assess the skin color. You want to look and ensure the color is consistent with the baby's ethnic background. And I'm going to look for some loss of pigment, so bluish color. This would be a normal finding on the extremities, so the hands and the feet, that may be normal, but if the baby has central cyanosis, that is abnormal. The baby may have a mottled appearance, so that's like inconsistent red and purple blotches, and that's normal. Skin texture should be smooth, soft, and flexible. The feet and the hands may be dry and peeling. That's a normal finding. I'm also going to assess skin turgor. So I'm going to pinch lightly here and let go. The skin should be elastic and return shape after letting go of the pinch. There may be some milia or keratin dots on the bridge of the nose, the chin, the facial area. That's normal. There may be cheese-like substance called vernix caseosa, as well as lanuga, which is fine hair all over, and that is normal. The baby may have what's called a newborn rash or erythema, and that's a normal finding. So red blotchy rash. The baby also may have vascular birthmarks around the face. And there's also pigmented birthmarks that would be a normal finding. One of those is Mongolian blue spots. So I'm going to turn the baby over because those are usually on the posterior side, especially in the sacrum buttocks region. All right. Now I'm going to focus on the head. I want to ensure the head is generally round, symmetrical. I'm going to test range of motion, so see if we can go all the way to the right, all the way to the left. The head should be soft and pliable. You want to note molding, which is a slight cone shape. That would be a normal finding due to pressure exerted on the head during birth. I'm also going to palpate the fontanelles. So the anterior fontanelle is going to be where the coronal suture meets the sagittal suture. This one's going to be diamond shaped. It should be flat and soft. If I palpate down the sagittal suture, I'll come to the posterior fontanelle. It should be palpable, soft, and this one's going to be triangular shaped. These fontanelles may pulsate with the heartbeat, and that's a normal finding. When I assess the newborn's hair, it should be soft, smooth, and silky, but it may vary depending on ethnicity. And I want to note where the hairline is. We want it to be a high hairline above the eyebrow, so not too far down. That could indicate some abnormalities. But to note also is in Spanish and Mexican descended people, it may be lower, and that is normal finding. All right, in assessing the face, I want to note presence of eyebrows and eyelashes. I want to make sure the face is generally symmetrical. Eyes, ears, the mouth, the nose is generally symmetrical. I want to note the baby's ability to make a grimacing face. That'd be a normal finding. Now when I look at the eyes, I want them to be bright, clear, and even. I'm gonna get my pen light here. The color of the newborn's eyes are typically blue-gray or slate blue-gray, but there may be brown pigment depending on ethnicity. I want to note the ability for the newborn to move their eye in all directions. I'm going to use the pen light here and see if the baby's pupils respond to light. They should constrict. And I also want to put a light right in the middle and note where the light shows up on the cornea. It should be in the same spot in both pupils. If it is not, then that may indicate strabismus. I also want to look at the shape and size of the pupils. They should be generally round and equal in size. The sclera of the eye may have a bluish tint. It may be white, and African descended individuals may have a brownish tint to their sclera. I want to look for jaundice, hemorrhage, and discharge in the eye and the sclera. That would be abnormal findings. All right, now when I look at the nose here, I want to make sure the nose is symmetrical on each side. The nares are the same size, and then I'm going to check for patency. How I'm going to do that is either use a pacifier or my finger and put it in the baby's mouth. They'll suck on that, and I'll occlude one nostril at a time. And I just want to make sure each nostril is patent and clear and they can breathe. This would be a good time too to test the sucking reflex. So my finger in there, I can feel the infant sucking on my finger. To test the rooting reflex, I'm going to touch near the baby's face, and the baby should turn his head to my finger and suck on it. I also want to look inside the mouth and feel inside the mouth, assess the hard and soft palates, make sure they're intact, make sure the mucosa is pink. There may be Epstein pearls, which is a normal finding. So on the mucosa, maybe just white dots. I also want to look at the tongue, make sure it moves freely and it can move in all directions. It should be pink, moist, and proportionate in size to the mouth. I'm going to look at the ears a little bit. So this would be a good time to test the Moro reflex or startle. So if I make a loud sound, the baby should become startled, they will straighten their arms, they may flex their legs, and their hands may exhibit a C shape. That's what we're looking for as a normal finding there. I want to look at each ear, make sure they're fully formed, check for any lesions, cysts, or nodules. That would be an abnormal finding. We also want to draw an imaginary line from the canthus of the eye, and the top of the pinna should be at that level or above for a normal finding. Low set ears may indicate complications. All right, now we're going to assess the neck. I want to palpate lightly, see if there's any masses or lymph nodes swollen. They should not be. Normal finding would be no palpable masses, no webbing from the neck connecting the shoulders. The trachea should be midline. And this would be a good time to test the tonic neck reflex. So I'm going to turn the head to one side, and the limbs on the same side of the body will straighten and the opposite limbs will flex. That would be a normal finding to that reflex. All right, now I'm looking at the chest here. I want to make sure the chest is generally symmetrical. They have 2 nipples. That would be a normal finding. The chest should have a circular appearance. It is wider than it is long. I want to note if there's any retractions. That would be an abnormal finding. All right, then I will move to the abdomen. Noting the appearance, it should be cylindrical shaped, no cyanosis here. It is normal for the belly to protrude above the chest a little bit. Now I'm going to palpate all 4 quadrants of the abdomen, looking for masses. Masses would be an abnormal finding. I'm going to assess the umbilical cord. I want to make sure it's not bleeding, and there should be 3 vessels present, 2 arteries and a vein. Moving on to the genital region, we want to, in males, we want to palpate the scrotum, make sure the testes are descended, make sure there's no fluid in the scrotum. Normal finding also would be the scrotum has rugae. We also want to note the position of the urinary meatus. It should be on the tip of the penis and not above or on the underside. That would be hypo or epispadias, which would be abnormal. Also want to make sure the meatus is not inflamed. On a female patient, I want to make sure that the labia majora and minora are symmetrical. The majora should cover the labia minora and clitoris. If we spread the labia majora and use downward retraction, we should be able to expose the vaginal orifice and the urinary meatus. It is a normal finding to have a little bit of a bloody discharge due to pseudomenstruation, and there also may be discharge or smegma under the labia as well. All right, now we're going to assess the buttocks. So we want to make sure the butt is nice and symmetrical. I'm going to test for patency of the anus. So we will stimulate on either side, and it should reflexively contract. I also want to note any fissures, tears, or skin tags. That would be abnormal. Alrighty, now I'm going to flip the infant over. And I want to observe the gluteal folds. We want to make sure those are symmetrical. Asymmetric gluteal folds, more on one side than the other, may indicate hip dysplasia. I'm going to assess the spine. It should be flat and straight and intact when they're prone. And I'm going to rub all the way down to make sure there aren't any vertebrae missing or out of place. We also want to make sure there's no open dimple or tuft of hair at the base of the spine that could indicate spina bifida. I'm going to turn the infant back over and let's assess the arms and hands. So I'm going to palpate, feeling the bones here. Make sure the baby has full range of motion in the shoulder and the elbow joints. Make sure they can move symmetrically. They tend to be flexed at rest. That's a normal finding. Equal arm length, we want to check for. Also going to count the fingers. Make sure they have 5. You may need to separate them in tiny hands. And we also want to note the general size of the hands. And then make sure a normal finding would be that the nails extend beyond the fingertips. This would also be a good time to test the palmar grasp reflex. So put my finger in his hand and he should hold on, and I'll pull away and he holds on. I'm going to do the same thing with the legs and the feet. Palpate down their bones, test range of motion, count the toes. I will test the plantar grasp reflex. Put it right under the toes, and he'll grasp my finger with his toes. I'm also going to check for club foot. So feet should be generally midline with the leg if they're turned way in, and I put a midline and there's resistance that may indicate club foot. This would also be a good time to test Babinski reflex. So on the infant, I'll go from the heel, the outer surface of the foot, and then across to the big toe region. And the baby's 4 toes here should fan out, and the big toe usually dorsiflexes. That would be a positive Babinski sign, which is a normal finding. Now I'm going to test the infant's walking or stepping reflex. So how we test this one is we suspend the baby and then get one of his feet in contact with the ground, and then that will elicit the other foot to go in front of that one and kind of imitate the walking. All right, now I'm going to test the hips, make sure they're in their sockets. We're testing for hip dysplasia. So the Barlow test is going to be with the knees flexed. We're going to adduct the hips and apply downward pressure. And if this downward pressure causes hip dislocation, which I could feel with my fingers on the greater trochanter of the femur, then I know they're dislocatable. And there's also a Ortolani test, which is similar. We're going to flex the legs and abduct them, rotate them outward, and when this test is performed, you may hear a click, and that click means that the femoral head returned to the acetabulum. Alrighty, now I'm going to test the baby circulation. So we want to palpate the brachial arteries at the same time, make sure they are relatively equal in rate, rhythm, and strength. We're also going to test the femoral arteries. Same thing, comparing rate, rhythm, and strength. And I also want to do the femoral and the brachial at the same time because those should be generally equal as well. All right. That concludes my newborn assessment. Now I'll cover the baby back up to keep them warm. Maybe return the baby to the mother and perform hand hygiene.